Hey there guys, welcome to the MPRX program. I want to say thank you for taking time to check out these video series of mobility, performance, and recovery techniques and movements that your body can benefit from through your own applications of passive assisted work. What this program is designed to do is to address ankle, hips, shoulders, neck, and back restrictions, limitations, or even some chronic pain that you might be experiencing. I always encourage people to check out the chiros, the physical therapists, the stretch therapists, personal trainers. There's always other components to what needs to be addressed. However, if you're stuck and if you're trying to deal with your own things and you're unsure of the homework or the proper, more efficient techniques that are out there that can benefit what issues you might be having, I want you to understand that this is what this program is for. We are going to start looking at our hip, okay? Now the hip capsule has a lot of different tissue and ligamentous tissue that gets glued down. So there's a lot of different muscles, whether you have your hip flexor complex that cross the hip joint or your extensor complex. There's a lot of different things going on. So it takes multiple movements, multiple ranges of motion, or a variety, should I say, of ranges of motion to really address kind of the whole complex of that hip capsule. Now your band is going to be anchored to your door or to a wall. I've got two anchor points, okay? One at the door handle for mid-height, one under the door for low height. Now what we're going to do is look at opening up the hip with some gentle traction from a self-assisted band technique, okay? So, I'm gonna lie on my back. What I wanna do is give some good stretch to this band. This is the first technique. I'm lying on my back, my knee is bent. You'll feel your hip bone, and I'm gonna put the band right underneath that hip bone, okay? Now again, we're looking at the hip capsule and some low back pain relief. All right, this is my position. So I'm gonna just relax into this position and let the band gently traction my hip away. All right, I'm looking at the angle of my femur. It's different, okay, than if my leg were straight and the band was pulling. Angles and variation of movements are important. So this is one. All I'm gonna do from here is I'm going to bring my leg up towards my chest. I'm going to actively lift, and I'm just going to hold. I'm going to let my leg drop out to the side and bring it back up. Let it drop out to the side. So my goal is I'm holding with my arm so I can still allow my hip flexors to relax. The band is just adding some traction into that tissue, okay? I'm going to bring it back down. Let my whole leg relax. A little side to side just to get some mobility moving in that joint. And now what I'm going to do is I'm going to take my leg and put it on the outside of the band and open up my leg a little bit more. The anchor point to this band is now going to feel more on the outside of my leg. And we've got this. Same idea. A little open and a little close. The band pressure is just helping to shear that tissue as I get some mobility into the muscle and into the joint. Next component is I'm going to shift back inside the band. I'm going to pull it back towards me. Let that relax. Let it drop out. Bring it back up. Now I'm going to just gently start to drop it across my body as well. Okay? I'm using my hand to just guide my leg. I'm not forcing, I'm not pulling. I'm going to reset. I want to shift my body slightly towards you. And what I'm going to do is bring my foot now on the inside of this band. Okay? We can shift our body more. We're going to have the band pulling now from the inside of the groin area. And I'm just going to, again, gently open and close. Don't worry about your other leg. Let that feel comfortable. If you can straighten it, cool. If you keep it bent, keep it bent. A couple of these guys. I'm going to shift back. Leg comes in the band again. Back up. And this time I'm going to gently grab my knee. Instead of keeping my leg straight, it's going to turn my foot across my body. Grab my knee and grab gently at my shin. Support my leg. Hug that leg so it's secure. And then just gently back and forth. Okay. So that's our movement for this video. Sit up, make sure you grab that band, unhook, relax it, see how this leg feels, see how that moves in conjunction to how your other one feels if you feel like you're a little jacked up. Now I want you to do both sides depending on where the pain is coming from. If your right side is bothering you more, I want you to focus on your right side more. If your left side is bothering you, focus on your left side. If you're feeling it on the opposite side of the leg that you're doing, let's try to switch to do the leg that you feel it on first. Open that side up. We'll go back and then start on the other side and see if there's still that cross pull or that cross strain. Usually there's not. So if I start on my right side and as I'm doing this I start to feel left lower back issues or tightness or restriction, what I'm going to do is switch to my left side first. Open the left side up, take that off, come back to the right side, and now see if that helped release some of that cross pull that was going on in the first place. All right, guys, so that's the banded hip wave. We're going to try that. You're going to feel how it feels, and you're going to let yourself start to learn how to relax into these positions. Again, I use my hands to support the leg so that it feels secure, that I can relax, my muscles aren't activated or firing. The band I'm using as an assisted pull, so it's helping to pull the traction with the joint or to help shear some of that tissue as I mobilize the leg. But again, the whole point is for you to relax. Relaxation equals release. All right, guys, that's this video. Stay tuned. We're going to have more on continuing to open up the low back as we need.